Okay. So it's very similar to what you did with me. We want, yesterday was National Thalassemia Day, and you were here with us last year, celebrating our first National Thalassemia Day.
Mm.
So it's just we want to get an idea of what life is like in India for people with thalassemia. So before I start, can you say who you are and introduce yourself?
Okay. So, to everyone who doesn't know, and like, of course, since we're doing this for the first time, I'll just give you a little bit of history. I started an organization in 2015. It's called as the Wishing Factory, and I'm the founder of the organization. I started it because even I am a thalassemia major patient, but fortunately, I come from a family wherein I had the privilege of having good health care and good facilities around me.
Yeah.
Unfortunately, unlike other countries, in India, thalassemia is not covered by insurance. So, or the healthcare is not free, which is why patients have to face a lot of struggle to even get chelators. Anything that you normally think of, any drops or X-ray or whatever medicines, patients need to buy them, or even the transfusion facility, people go to private healthcare settings, which are very costly. So there are a lot of loopholes which still need to be filled. India is getting better from where it was in the past 10 years.
Okay.
But there's still a vast way of development. So I saw this gap between the need and the gap. So it's called as a need gap thing. And I used to feel that, we are not doing enough for thalassemia children. Which is why I really want to, like in India, the average lifespan was relatively 24 to 26 years, which is actually a very sad thing because ferritin was not obviously managed well. So, given all these points in my mind, I thought that I really wanted to do something, and that's how the Wishing Factory was born. So far it's been 5 years, Roana, and we've been doing normal healthcare support. We've set up a couple of transfusion centers, basic ones, 3 beds, 4 beds, at least to get proper facilities to our children. It's all free of cost. We don't charge them anything.
That's
Apart
amazing.
from that, we have a pump library concept, which is of course pretty much supported by even you guys, wherein we have pumps, so even UKTS has been kind enough to give us a few pumps which we use on a library basis. So, for example, a couple of children who have their ferritin high, they can borrow a pump, use it for a year or two, and return it back.
Yeah.
Once their ferritin is controllable with oral chelators, they return it back. So, we also have this because otherwise, a pump is really unaffordable. And apart from that, we also do a lot of scholarships. And the last thing that we somewhat try and do is spread awareness.
Which I think it's such a for such a small team, you guys are fantastic in what you do, and Pat, for creating this idea. You were what, 19 or 20?
Yeah, I was 19.
To think of like
19.
such huge things, like huge dreams, like to have that at 19. I certainly didn't have that. I was too involved in my social life and everything. I did support thalassemia, but not like what you did, and I think it's fantastic. So first, let's start with you. Tell me about your story, and then we'll go into the society and the work you do. So tell me, so when were you diagnosed? Were your parents aware of thalassemia?
I was diagnosed when I was 3 months old, and so that was my dad always knew that he was a minor even before marriage. But my mom, she didn't know. So while during her pregnancy, she got a test done. But in those days, Ruana, the tests weren't that accurate. So she got a false negative.
Okay.
She got a false negative, which is why she continued with the pregnancy. Otherwise, she could have opted for an abortion and tried again. But she got a false negative, and turns out that I came out. And since I'm here, it's just been a task because, when for the first 3 months, I was a little pale and like you can't really make out in the first 2 months that what is really wrong. But then by the third month, there was normal wheezing and some thalassemia symptoms, which kind of led to the diagnosis. And since then, I've been needing blood. that's about my quick story.
So did she? I want to go back to. So your mom got a false positive, a false negative. Sorry. So she had you, and of course she think that you were possibly have the trait as well. But so when you were born, they weren't worried that you had the condition at all, and then you started getting a little bit pale. And did they realize then, or they took you to the doctor, and that's how it was? Like, what were they? What was her kind of thinking at that point when you were? I guess you were not feeding well, and you were
So
fatigued, and
I was born in a city called as Indore. It's a small city in the central part of India, and I was born in one of the best hospitals in that city. The healthcare was phenomenal and everything. But so my parents, from the first point of thought, were really, not happy with the doctor because it was a false negative at a hospital which is maybe one of the top most in India. Was a little hard. So initially we were all mad upon the doctor and all of that, but I guess after a week or so we accepted it. And moreover, yes, the initial symptoms were majorly paleness, and which is why my mom, dad they started doubting because after the first 3 months I was really very pale. I wouldn't cry or move around as much as an active child would. So those couple of symptoms kind of gave an indication that something is wrong. And then, yes, like a chain reaction, you did a couple of tests. Your CBC counts are low, your hemoglobin is low, then that refers to another test. So, all in all, by the third month end, I was declared that, this boy has thalassemia major.
And your first transfusion was at how old?
And it's the same, like the 3 months.
3 months. Okay.
Yeah.
And you have them and what is it like now? You have them every 2 weeks?
That, so back then it was about once in a month, once in 2 months initially.
Okay.
Then once in a month. Today it's about once in 16 days, 16 to 18 days.
Okay.
Which is about 2 bags of blood. But the bigger one, like it's 350 ml.
Wow.
350, 400.
I think our bags of the biggest I've ever gotten was about 304 mils.
Yeah. So typically what I've done is I have like a couple of friends of mine who were with me in school. So they are, frequent donors, and luckily, touch wood, all of them are really healthy. Healthy. Like I get a lot of blood from them.
That's really good. And what about so when did you start using iron chelation? How old were you? And I guess you were using the pump.
I think I started using iron chelation when I was about 3 years old.
Okay.
And the understanding of thalassemia back then, Ruana, was very limited. Like because we were hardly one or two doctors, and to give you a reference of scale, I stayed in, for example, the city that I stayed in. If that was London, the doctor that was available was Scotland.
Okay.
So it was a massive travel, and it was not really practical. You don't have teleconsultations and all those things. So I didn't really have that bandwidth to, not me, of course, I was too small, but my parents didn't really have the bandwidth to understand chelation that well. So it took some time, but by 3 years I was on chelation. And since then, on and off, yes, I've always been on chelation.
And what about now? What type? Are you still on the pump? Are you on combination?
Yeah, I'm on a combination of both, which is the pump and what do you call it?
Deferriprone, yeah.
The Feliprox, yeah.
And how did you find that? Like having to do? Were you as bad as I was as a child with taking desferoxamine?
Absolutely. Like I was pretty much like, not like you're much better, but like most, those, you have those, what's the word for it? The children who don't listen.
Little rebels.
What are they called? Yeah, rebels. So I was one of that perfectly. And, in spite of being like, I saw my ferritin shoot up to 9,000 also at one point, 9, 10,000. And then I've, like, after I met you, you also put some sense into me and a couple of others here and there. So I think the real time when I really realized that how important managing of ferritin is was probably when I turned 24.
Okay.
So
I
it's
should have
from
met
3
you
to 24.
before.
So from 3 to 24, essentially, Rohana, I was just a rebel.
I feel like you're still out, but it's good that you're doing your chelation now. And what would you? Because I often have to give talks to parents and to children about that time, and I'm very honest with them to say that it's not easy. It's
Hmm.
quite a difficult thing because parents will say, well, you have to do it, but I feel like when you're in that position, you have to be honest with them and say, yes, you understand it's like difficult. I felt the same way. What would you say to kids who are going through that rebellious period? And I think it's amazing that we live so far away, but our stories are very similar. The condition kind of really brings us together. But what would you say to the children in the UK? And I shouldn't just say children, but young adults in the UK and in India and around the world. What would you say to them about being a rebel?
No, it's not a good thing, honestly. It feels kind of cool initially and all, but if you guys want to pull it and go for the long haul, see yourself on a rocking chair when you're 50, you need that chelator right now. Just get it close to you because it's very important. Thalassemia people can have a very normal life, and it's all on to the chelation. If you really want to live it the normal way. To all those adolescents, teenage people, it kind of feels cool that, oh, I'm gonna miss my dosage and prove a point, but it doesn't, and it's gonna hunt you back, like it is hunting me right now. So imagine if I was a good boy, and I started chelation back when I was 16. The whole incidence of having a higher ferritin wouldn't really have, I mean, such a stress for my health, which it is right now. So, I realize this from my own mistake, and I don't even mind admitting it. But for all those who are still doing it, I would actually advise you that please don't.
Yeah, because the thing is, like, I remember at 13, because my ferritin was really high, and when they scan your liver and heart, and
Hmm.
my results were really bad, and it looked like the worst cases you see in the textbooks. My heart was black
Hmm.
with iron, and I remember the doctor saying to me that you could go into heart failure, but at 13, that meant nothing to me. I felt fine, and that's the problem with iron, because you feel fine, you feel
Hmm.
invincible, um, and then you carry on. And I think when you see your friends living their lives and not having to have a pump attached, it's quite a difficult freight. Like, it's quite a difficult thing. I don't think it makes you a bad person. You said, you weren't a good boy. I think you were always good, but the circumstances are quite challenging to deal with. And I think people
Absolutely.
do
I
need
think
support.
what you're saying is absolutely right, because what happens is children, especially adolescents, they usually crave that feeling of normalcy,
Mm.
which is why, that time even I wouldn't want to have a pump hanging around with me all the while. Uh, so that mentality, but I think Rana, somewhere we need to break the chain. Like I mean, like even all the innovative comics and all that you have created, which are kind to circulate or to have people understand what is chelation in its true sense. We need to come up with more such strategies, or more such informative material to actually explain that how chelation really helps. Also, I think in most cases, if at all that is not working, parents can also incentivize it, like incentivize it as in like from smaller treats, like Roana, if you chelate yourself for this month, I'll buy you a cycle or whatever, like those basic.
But the problem is, and I can say this in the UK, is that parents in some, you could try to, I wouldn't agree with incentivizing it in that way, because if I had a child with thalassemia, and if I had me as a child with thalassemia, I wouldn't have been able to afford to
I
incentivize.
understand.
I
This is
wouldn't be
just,
able to afford to
don't
do
take
that.
that as my first option. I'm just saying,
Yeah,
keep that as your last
yeah,
option. And if only your finances permit you at all, like, and I'm just saying it can be incentivization even in the smallest form also. It can be even an ice cream.
yeah.
So,
We do need
so
to,
I'm
I think
just,
we do need to create more literature. And maybe we do, like, I wanted to write storybooks. I wish I had a twin with obviously better genes, but I wanted to do like storybooks and try to, because I remember the first time I saw something with thalassemia and it resonated with me, because usually you'll see things for cancer and diabetes, but never for us. And I feel like children will really benefit seeing a storybook with them that represents, it looks like what they look like. And you know, and like with the pump, I don't know if this is something we could work together with, Partth, but I saw, I wanted to create a teddy bear and put
mm,
patches on the teddy bear where we can put the pump in, so that they can have
mm,
this teddy bear and carry it around, but know that, okay, in their, like in their stomach we put 4 patches.
mm.
But I think something small like that would make it feel like, and when they stick themselves, they stick the teddy bear and have this, obviously with safe things,
The
but
connection between,
yeah, but something that I would make them feel like they're not alone. I don't know how you
mm,
feel about that, but I feel like there's a lot more things we could do. And that's one gift, but I feel like it's a gift that will keep giving.
mm.
There's
No,
a
I
lot
think
we
that's a
could do.
wonderful idea, Ruana. And over the past 1 or 2 years, even I have also been wanting to venture into a space like this. So, what you are saying is essentially a type of a therapy toy,
Hmm.
but not exactly a therapy toy, because therapy toys are usually to cure anxiety or those kind of
Let's
mental.
say it's a friend. It's
Yeah,
something,
it's more like
yeah.
a friend wherein it behaves in a similar fashion, and every 15 days you kind of take it to your transfusion, maybe have like a smaller IV stand and you hook it to it
But I
as if
think,
that person is.
yeah, I think it will be something we could create.
Yeah,
And
and personally, like, I feel this is pretty much doable. It's just that we need to kind of invest a little bit of time onto this, but once it is, like, I really like the idea. I'll connect with you on this.
yeah,
Maybe there are ways to
we could do a joint
uh,
venture here.
yeah.
Okay, but I do think we do need to do more for the younger generation and create things
Absolutely.
that we would have benefited for, because, you know, like in
Mm,
the UK, we're fortunate to have people who live until 60. I think the oldest is about 63 years old now with thalassemia major,
mm,
which is exceptional. And I hope that when I'm 50, I could have abs like J Lo does. So I don't want to
mm,
think about being in a rocking chair, but imagine what our future, like the younger generation will be like. And I feel like we need to do a lot more for them now that we have better treatment. There's, like, once you take your iron chelation, you are slightly invincible, and now there's curative things that will come in to play. But we do need a lot
mm,
more to give people hope. It's not a childhood illness anymore. People don't die in childhood like they did 20 years
mm.
ago or 40 years ago. So I think there's a lot of things we could do there.
No, it's a very good way. That's a very good point, and I hope like the average lifespan, not just in 1 or 2 countries, but overall as a world, we progress in a direction wherein the average lifespan of thalassemia is increasing, and also we just treat it in a way wherein it's just something that you got to live with
Yeah,
and manage it.
exactly. And the important thing to note is that you can manage it. It's
Yeah,
and I think that the sooner that people realize that you do have control, like for example, if your ferritin is really high, you have that power to remove the iron and to get it out. It takes a lot
yeah,
of
you got
it
to
takes
work
a
on it.
lot of things, but you're fully in control of this. Um,
Yeah,
so I think that's kind of some of the messages we need to put out there, because I looked at a video that we got from a child in Bradford, which is north of England, yesterday,
I
and
saw it. I saw that.
and it
The
was,
girl on the recliner, right? She
yeah,
was
and
telling this is the nurse.
and they asked her,
Yeah.
what do you want to do when you grow up? And she called out a list of jobs. And I remember at her age, I I wanted I wanted to work in thalassemia, but in the back of my head, I didn't think it was possible, because I saw my friends die when I was 15, like, at 15. So at her age, I thought in the back of my mind that I was counting down the years, like I had 4 more years left or 3 more years left. And I looked at her, and it was such a nice thing to see how excited she is about her life and her future. And I want more children to have that, because I didn't have that. And I don't know if you had that, but did you?
No,
What?
I think in these parameters, one, I'm exactly. I think it's just amazing how similar our life has been. Like, but like it's crazy actually. It's not even. Uh, it's very hard to believe. But yes, even I was also in the same headspace. When I was 16, 17. Because what I would do in those days, Google was a very big invention.
Hmm.
So when I was 16, this was back in 2010 or 2012, roughly around that time. And that time, Google was just accessible to us in India. So I used to Google that how long do thalassemia children live and all that. So you had that headspace, and I knew that time is coming. I need to start counting backwards. I used to tell my parents that now I need to have what I like. The meals should be as per my liking. So you basically try to plan your own death, but it really doesn't work like that. As you perfectly said, you need to manage it, and you need to look forward to your life.
And take the reins. And I think this is where we differed, because if I told my mum I need this because I'm counting down, I probably would have gotten slapped. Because my parents kept me very, very positive, and I was not allowed to, so which is why I didn't say it, but I did think this at the back of my mind, because I saw the children dying at that point. But I didn't, but it was quite a difficult time. And I think when I realized that I could live is when I met some of the older patients and I didn't know, and they had children and they had grandchildren, and I was like, I didn't know this was possible. And that's where I got this kind of hope. And then I saw some people who had developed diabetes, and I thought, having one needle for Destrol was difficult, and they were doing so many shots during the day, and then had to check their blood sugar, and they couldn't eat things, and that's when it kicked in for me. And I feel like with children, they're not going to understand these things, but we need to give them that hope, because there is hope. There's a lot that's changed from when we were kids. To see, I mean, you met some of the older patients when you came to London, and they had children, and they were married, and they were having the time of their life, dancing on tables at in their 60s. And that's the kind of image I think children need to see. And it's not a condition. You have something, but it doesn't define you. It's just part of you.
No, I think, yeah, what you're saying is right. And I hope someday we can come together and, just burst all of this myth that everyone carries.
Yeah, like this bad blood. Like, I heard somebody say it recently about people with thalassemia and the trait and having bad blood. And it's such a bad myth, because it's not having bad blood. Having the trait is a sign of evolution, and you're kind of superhuman to have the trait. It's just when two traits come together, and that's where the issue lies. But I heard them saying, even for somebody who had the trait, that they had bad blood, and we need to correct this, because having the trait is not a bad thing. It's not a sign of weakness in any way.
Yeah, absolutely.
And people do think that. So what about the blood donation situation in India? I know that you have to you said your friends donate, but is it for the people in the benefit of the UK? Is it a voluntary system, or do you have to find donors each month?
To be very honest, it's a voluntary system, but given the current circumstances, due to the COVID situation, the donations have dropped a little, because what happens is, in thalassemia you need frequent blood, as I'm sure you're aware of. So you need a lot of camps, and since these camps are not happening, Rana, because of gatherings are restricted, right now. So there's only like one or two people going here and there voluntarily to a camp or to the bank directly. So which is why the donation outflow has decreased a little, but I'm still saying it's not the worst. We are getting better over the last 2 months. the banks are significantly well flooded with blood. Like it's not that bad as it was in March or April. So yeah, otherwise,
But is this a
apart from the COVID
situation?
situation,
Sorry, but
yeah.
is this a situation in your kind of the centers you've opened? What is the situation in India? Is that a similar look? So another hospital who's not funded like you, what would somebody else, a child who doesn't come, like who's not in your centers, what would
Mm.
their like situation be?
So then, yeah, that way, if I have to give you a very holistic answer, then yes, the situation is a little bad. Uh, so so the centers that we have, of course, all those centers have proper blood supply, and there's no shortage at our end, except for a couple of blood groups, AB negative and all that. But then that also we have our fixed donors. But coming to, there are some cities which are a little backward, Roanna, which are a little not a little lesser developed, where there is acute shortage of blood. So then what happens is the children have to travel. So it's like about an hour or two commute. Like I don't know where was the office? Southgate, na?
Yeah,
The UKDS. So from that you can imagine to maybe,
I can
I don't know,
imagine what an
Liverpool.
hour. Yeah, can,
Like an hour's commute. You have to shift to or go to a better city or a better district where there is blood. So there's some internal travel you have to do. That's all. Like,
and do
but
they have to find donors? Like, so in Trinidad, the reason I'm asking this is in Trinidad, when I was treated there, every month, my parents, luckily we had donors, but you had to find donors. And I had situations that we heard of where we were living in the UK, but there were children in families with like two kids with thalassemia. And the
hmm,
blood bank would give them 1 unit of blood, for example, and say, well, you need to decide between which child you want to give it to. And that's the kind of really terrible stories that it was rare, but we heard about.
hmm.
Um,
No, so Ruana, that way the situation is not that bad here,
hmm,
because one of the reasons why a government doesn't, as per the mandate, you're not supposed to, ask for replacement for thalassemia. You're not supposed to replace blood. Like the bank is supposed to voluntarily give the child whatever blood and how much ever blood
that's
the
really good.
child needs. So there is a mandate that supports children in that way. But yes, to be frank, sometimes blood banks are moody, uh, and they may have their own tantrums because they are also running low on stocks.
Yeah,
So they often say they also kind of put it as a request only that please help us with a couple of donors from your end or something. So but this is the situation right now, Ruana. Even the children are a little understanding. But coming back to your primary question, yes, this as per the banks are mandated to give blood as much as the child wants
which
without
is
any
excellent,
replacement.
which is good because I in
Yeah.
other countries like they didn't do that, and the child would not be given the blood because it's not an emergency. So if somebody came in with, I don't know, a wound or had a car accident or something and they were bleeding, obviously
Hmm.
they will get priority over somebody with thalassemia. So
Hmm.
it's reassuring to hear that's not the situation and that you do have a mandate there that prohibits
Yeah.
people from doing this. That's good. Um, and in your center, you said that people can access iron chelation easily. What
Hmm.
about other hospitals? Now, I know you said in you have to pay for these
Ruana,
things.
just give me like 2 seconds. I'm just gonna close this door behind. There's light
Okay.
coming on. Hmm.
So,
So yeah.
what is the iron chelation? And even in your center, do you find it difficult to access this? It's quite expensive medication.
Yeah, that is the case. Okay, for government, what has happened now is most government hospitals, there are chelators available for patients, but those are the generic ones. So when I say generic means, you understand the concept
Yeah,
of a
yeah,
generic. So the same Feriprox, which is like a very efficient medicine,
Mm-hmm.
is now replicated by a local pharmaceutical company, and that is being given out in government hospitals. Usually that's the case. So that is primarily not so effective or as efficient as
The
the normal
actual,
molecules such as
the
your
branded product.
Defibrone or your Tesirox, your Asundra and all these
Mm-hmm.
medicines. So which is why there are some patients for whom it works also. I'm not against the concept of generic drugs, but for some it really doesn't. Which is why right now the scenario here is that some children take it from the government hospital, while for some whom it doesn't work, they approach us. We try and help them with chelator drugs. For some patients, we completely subsidize it to make it free. For some patients, we bear 50% of the cost. For some
Okay.
patients, we bear 10% of the cost. But we never give any drug at its original price because we always try to bear some amount of the cost on ourselves. So that's the ideology. But then this differential pricing is big because some patients are professionals, they are working, so they
Mm-hmm.
can afford a little bit. There are some who really, really can't. So that's how we have a differential pricing.
Which I think it's fair that, you know, they make some
Yeah,
kind of contribution based on their economic status.
exactly. So someone who is like having a basic job, they can afford chelators at 50% cost.
Okay.
So we try to find those, in short, chelators, there's no shortage as such. In case there's any shortage, if I don't know if anyone is watching or anything, please do reach out to us. Because we are always ready. We have all of the medicines that a child may need, like right from your Desferol to your even the new ones, which is this XJ
Mm-hmm.
360, Colectis.
Yeah,
Uh, we have all of those also. So like whatever a child needs, we can just always step down and come and help.
that's excellent, Partth. It's so incredible to see and really inspiring that you created this society and it supports like a lot of children. How many children do you support in, and how many centers do you have that you create?
So currently we are having three blood transfusion centers
Mm-hmm.
and six thalassemia wellness centers. So these wellness centers are typically a smaller concept, Vana, which is more like a small room of about just a room, and where patients can they come for counseling, they come for therapy, they come for basic classes, Zumba,
That's really
yoga.
cool.
So we have this in different cities, but it's exclusive for thalassemia patients only. So it's like their exclusive recreation space.
Mm.
So that's the wellness center concept that we have. Because there's a lot of social anxiety that patients have. Often patients feel that they don't look as good as normal people. They have the this issue of having that nose, a typical thalassemia nose. But those kind of they have that rigidity to open up. So we
Mm.
try to break that, and which is why we have a wellness center concept. We have three blood transfusion centers. The one I am right now talking to is the newest one that we have made,
Okay.
and one more is under construction in Dahod, and there's one more that we are opening, which is in a desert. It's in Jaisalmer. Uh, you understand the desert now, like
Yeah, yeah, yeah.
it's like a lot of sand and all. So
I
that
know what
one.
a desert is, Partth. And how many children would you say come to these centers?
Typically, this one and the one that I'm sitting in, we normally have approximately 160 blood transfusions a month.
Wow.
160. So depends. On an average one, it can be anywhere between 100 to 220 per month.
That's
So, and
incredible.
then you can multiply that with the centers that we have. So, like
That's
that.
incredible. Um, and as a society, what are some of the, and I bet that you guys will have similar things with us because you're fundraising to create this, but what are some of the other challenges that you have that you face,
I think
whether
as
with
of
the
now,
government or within your centers?
As of now, Rohana, I think the primary challenge for me is sustainability.
Hmm.
Sustainability for a non-profit is very hard, which I'm sure even your mom wouldn't disagree, because the constant need of funds to sustain your work is kind of takes a lot of toll. So that part is a little hard, and given the current pandemic, it's even harder. So that is the only situation which is right now a little tough. But I think there's something which we call Diwali, which is like, you know, Diwali, right? I have to explain you because the Indian concept is a little different. So, but yeah, Diwali is. I feel it's gonna be it's a new, a fresh start, and it's like the times are also getting better. Even the COVID situation, I don't know about what's the case count and all of that, but I feel we are normalizing stuff
Okay.
uh, somewhere around like overall the in general we got to live with this for a lot of a few more months at least. So which is why overall the mindset is getting a little positive. With all that happening, the only problem which is sustainability should go away, and the second problem that I feel is the government attitude, which is a little sad. But I just hope, Ruana, that that changes with time, because what has happened is government looks at every disorder in terms of population metrics. So thalassemia in itself is such a small minority that basically we don't hold any value to move a
Which is a
decision in.
similar issue we have here.
Yeah. So that is the same problem, to be very honest, in a population of, I don't know, India is right now 100 crores. I don't know about the population, Vana, but it's a lot. Okay. And we as patients constitute of not even 0.0001%. Like we just no one. So that attitude to treat or equate everything with population dynamics is a little sad in India, because you can't just equate everything with a population dynamic system. You know, these people are just say 1,000, or in India there's about 1 lakh.
Okay.
So that's just a too small number. I don't think disorders should be looked at that way, because I am just very against that.
I agree with you. Like in England, we have 60, the population is 60 million people in England. And
Hmm.
out of that, we have about 1,200 with thalassemia
Hmm.
major. So it's quite
Hmm.
a small number. So we are often, and we often have to fight to even be
Hmm.
heard, because we represent such a small figure to them. And they have according, and this is actually said to me, they have bigger fish to fry, a kind of
Hmm.
thing. Um, and we have to fight for this, like, even, which is why we had thalassemia day, to try to raise more awareness, because even the blood service, despite of how, despite how much blood we get as patients, we're still
Hmm.
seen as such a small category that's not as important as others. um and thalassemia affects so many different ethnicities. I think it's
Yeah.
one of those conditions that affects the majority of the world. And and yesterday we did an interview with somebody called Professor Bernadette Medell. I don't know if you've ever heard about her, but she was sort of one of the pioneers with thalassemia in the United Kingdom, and she
Okay.
created the services. We can boast about some of the services we have because of their pioneering work they did um,
Hmm.
over the last 40, 50 years.
Hmm.
And she was telling me that, on a global scale, like 20% of the world's population carry the alpha thalassemia gene. That's a huge amount for alpha thal, and this is not even beta
Hmm.
thalassemia we're talking
Hmm.
about here.
Hmm.
Um,
Hmm.
so and she shared my disappointment with how things were being handled, and that we were not being prioritized as a condition.
Hmm.
And it's a shame that it's still occurring. So I
No,
like it's something that
the
it's we don't know how to fix it, because the government do look at the population matrix, as you say. So it's quite challenging for us to even consider how we go about trying to fix this.
I think they are not what I, and it's important that we kind of bring this out here. But I'm sorry, just a second. Yeah. So it's kind of important that we bring this out here, which is that they are looking at it from a very superficial scale, but they don't know that the odds of two minors meeting is relatively very high. Given the fact that in India, then there are at least, especially from the states that I live, or the states that we work in, the occurrence of thalassemia is pretty high. And to an extent wherein there's 1 in 14 who's a minor.
Okay.
So that's not less, Ruana. The probability of meeting, if I'm a minor, and the probability of me meeting another girl who's also a minor is relatively 1 in 14.
Which
That's
is
not
very
at all
high.
a
No,
small
that's
probability.
really high.
So, and you never know, like these things are not really evident. The minor trait is not something you kind of wear on your face. And
Exactly.
uh, so overall, I think it's just kind of sad, and I just hope their attitude shifts. But prima facie, yeah, we need better management, not just in India but globally.
We do. And in the UK, well, in England, I shouldn't say the UK. We have a sickle cell and thalassemia screening program.
Mm,
And every woman, well, so every pregnant woman in England um,
mm,
gets screened for thalassemia by
mm,
her 10, I think it's by 10 weeks plus 6 days. So
mm,
she will know at that point whether she carries a trait for thalassemia. Sickle cell is a bit different. Um,
mm,
but we do have a national screening program, which
mm,
helps. But
mm,
I feel like sometimes it's too late because you're already pregnant at that point, and then you have to, then
mm,
you have to get the biological father to come and get tested, which we don't even. I think we have about 65% uptake of fathers coming to be tested because there's this concept.
mm.
Well, thalassemia comes from the mother's side and not the father's side, um, and then they go through
Absolutely.
the kind of pre they go through the prenatal diagnosis testing and those kind of things after. But
Mm,
I feel like if the government's not going to do it, we have to spend more time educating the younger ones about why it's important. The good thing is I think our generations are very educated now compared to previous generations, so they do understand the implications of
mm, mm.
what a long-term condition is. So that's where we have to target the younger, because I feel like there's only so much we could do with the government now, but we have to educate the general public
Absolutely. Yeah.
about this, which is
And
sad.
and I think this is like unless we do it the way uh like on a more like thalassemia testing, Rohana, the whole problem with thalassemia testing is that the there has to be more number of touch points for people. Touch points, when I say touch points, the accessibility of the test should be like very, 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 very high. Like it should be like, if I have to give you an example, it should be on every airport, on every station, on every, like
Yeah,
that's the dream, that's where we want to be. That even while flying out of UK, or even while flying in UK, you need to have a mandatory thalassemia test. Like it should be that uh, at least for 1 decade also. If we continue this, we can kind of wipe it out.
we get what's nice to see in countries like I think it's Turkey and and like Cyprus was the first country to do this to kind of eradicate thalassemia, and the births, the
Mm,
children that were born were because they were chosen to be born. But
mm,
before they did like premarital testing, which I think it's
mm,
amazing. Um, and everybody knew their kind of carrier status. But what we find here is that the Greek Cypriots here, they think that thalassemia was eradicated with their grandparents and their parents, and they don't think that they still carry the gene. And now we're finding that we have to re-educate them because we don't have that kind of testing in the UK.
mm,
But the concept is really good, and it tells the Cyprus is a Greek Orthodox kind of it's Greek, it's Orthodox kind of religion, and before they do they have to before they go up and show up to these churches, they have to show them their test
Hmm.
so that they know.
Hmm.
I don't know how we do this in this kind of society now, where you don't have to get married anymore. But we do have to try. I think the education of and going into schools and things it should
Yeah,
be.
even
That's
that,
where we
that is
should.
also, that's somewhere where maybe we can faster progress. Like that's a relatively a more feasible idea, which you're saying that, if a child is graduating from 10th to 12th, 10th grade to 12th grade, even there he should have a test.
Yeah,
So you need, those accessible touch points, which I was saying. So it can be even in schools.
I think
So
that's where you go, and I don't know what age 10, like grade 10 or 12 is there, but like say 15 or 16 when you graduate
yeah, yeah, that's
secondary school
exactly
here,
right.
that's when you should. I'm trying to read the comments too, but that's where you should do it. I think they should, because I think girls have to have certain vaccines at that age, and I feel like it should be a prerequisite for them
Mm-hmm.
at that point. um I'm mindful of the time, but is there anything else that you'd like to add that you think we didn't talk about? I mean, I think we could go on for having conversations for a whole 24-hour period and not cover everything. um But is there like what in the UK we have like before COVID we had 7-day services where people could go Monday to Sunday and have transfusion, so they didn't miss work or school. In an ideal world, what would you like, and what would you hope to have apart from
For
eradicating
thalassemia?
thalassemia?
No, no, I didn't get the question correctly, Rohan. Come
So
again?
in the UK we're trying to now, because morbidity isn't an issue, and now we have people in their 60s, so we are
Hmm.
focusing more on quality of life things, like trying
Hmm.
to put
Hmm.
their transfusions around their work, and not for them to have to take time off, because in the UK
Hmm.
some people actually their employers say that they have to take holiday leave just to have transfusions. What
Hmm.
in your centers, do you have that? Can they, or is it certain times, or what would you hope that it evolves into?
Currently we don't have like a night transfusion system, or
Okay.
like a transfusion wherein, so we have a normal functioning which is say 9 to 7, or 9 from the morning and 7 till the evening. So that's the goal. But Ruana, what I'm now kind of also trying is to also have something called as a home transfusion.
Mm-hmm.
It's a very far-fetched idea, huh? But
We do that here
yeah,
for some people.
yeah, so I'm kind of working on a home transfusion system. So which is like you have a transfusion in the comfort of your home,
Yeah.
and the entire setup comes to you, and there's a doctor, there's a nurse, they be with you, and only the cost dynamics are not working out. It's pretty pricey to have a home transfusion facilitated, but I see that as a idea for many, because they will then get to skip the commute,
Yeah.
and the blood will come to them, not the other way around. So
That's such an excellent idea. And in the UK, we only a few have that option, and I think it especially in COVID, the ones who
mm,
are most at risk. But I
mm.
think it would be it's such a incredible idea to have transfusion in your own home and not have to waste
No,
your time.
I am kind of the reason why I'm kind of looking forward to it, because it's just accessibility, and as far as thalassemia, everything can be better with accessibility. So imagine a transfusion coming to your place. So at least half your stress is done.
Yeah.
Uh, your mom doesn't have to cook you a tiffin like how she did for you. So she can just cook and you eat that hot whatever is she's making at that point. So I think these micro happinesses, or however you want to put it as, but will make life better. I'm planning to start it for one city very soon, but just to try it on a pilot basis. I don't know how children will even respond to this, And but yeah, that's just one of the ways
I
to.
I think that's such a incredible thing, Pat. And we wish you all the success. I wish our system is kind of, our health system is a national health system, so we are not able to do that for everybody. But that is quite forward thinking, and I really like it. But again, I have to thank you for agreeing to do this. I know somebody asked why we did a national day in the UK, and it was because thalassemia is very underrepresented, and we didn't feel just having the International Thalassemia Day was enough. We wanted
Hmm.
to raise the profile of thalassemia, and this year, so last year we had a screening event where anybody could have come and be tested for thalassemia or sickle cell
Hmm.
and sign up to be a blood donor. And you were there for that,
Hmm.
but this year obviously we couldn't, so we had more of a virtual celebration, and we raised quite a lot of awareness on Twitter and Instagram and Facebook, and the doctors also participated,
Hmm.
and the nurses. So that's why we wanted to make more noise. Thalassemia needs to be more, I want it to be a common thing, like how people know what cancer is. I want it to be such a common thing that when you say thalassemia, they're not like, thala what? Because I want it to be that common. So
It's a
I think
nice
we need
name.
more of
Like
these openings.
it's kind of cool. Like it sounds nice. Like I kind of feel nice when I say that, I have thalassemia. Like I just it really sounds cool. Like I don't know if it does in
It does
everyone's
sound
head.
cool, but I think the
Yeah, it's
first
like a very
time
rich
people hear
disorder, it's like a very elegant, uh, it's like how you have Gucci and Prada and all that.
it,
So it's
like,
like,
I wear
it's like
thalassemia really well. Yeah,
that. So
definitely.
yeah,
Pat, thank you
how are
so
you
much
otherwise? All
again.
good?
Can't complain. Cannot complain. Apart from winter, and
Okay.
in the UK is kind of in a kind of semi-lockdown state again, but I
Mhm.
think they're handling the corona cases a lot better now than we did in March. So we are quite hopeful. It might be a very quiet Christmas, but at least we're safe and well.
Okay, Rohanna, great speaking to you always.
I hope we do
See
this
you soon.
soon. Yeah, take
Yeah,
care.
bye.
Bye.